Hello, everybody. This is Dr. Richard Cheng. Dr. Tom Levy and I had the pleasure of interviewing Dr. Ken Walker, who will be turning 102 years of age in February 2025, to learn his secrets to longevity. Dr. Walker, a renowned Canadian physician, columnist, and a prolific medical writer, survived a heart attack some 28 years ago. Rather than taking statins as his cardiologists recommended, he took high doses of vitamin C, about 10,000 milligrams per day, along with other micronutrients. Today, at 102, he remains vigorous and continues to lead a productive life. This is something that I like to pick your brain on, is that a lot of good things, we're talking about magnesium, C, D, nattokinase, that which, like K2 and the omega-3. So my view is right now is, hey, these things are all good.
Good.
And I want all of them because I want to live to 120. So it's not just one agent, one vitamin, one nutrient. We understand biochemically. I have a biochemistry PhD, but actually I think I learned more biochemistry from Tom Levy here, is that they work in the system synergistically, just like a teamwork. You need all of these. CoQ10, of course, we need that too.
Yes, I take
Lipoic acid, of course, we need that too. I mean, these are the very essential ones. So I believe we do need to have a, sort of integrated approach, needing all of these, at least basically. I mean, there are so many different nutrients out there, including so-called phytochemicals. Even if we had plenty of supply, which I do, I mean, we can all of us sitting here, we can follow all of them. However, we can't handle them because that's way too many. Therefore, how do we pick and choose?
Is you can only swallow so many pills.
Yeah, you're absolutely right. That's the very practical point, is that there are so many good nutrients, we need them, and many of them we need high dose, optimal dose or also molecular dose. It turns out to be so many and so much in quantity. We can't practically, even if we were given for free, it's not practical, right? That's the problem I'm facing. And so how do we differentiate among these nutrients? What will be, so I'm thinking of more like the essential and the not secondary kind of thing. What comes first, what comes second? These are some very practical and points, don't you all think?
I think you're perfectly right, but I think when you get down to the basic analysis, the most important thing you do is take vitamin C in high doses.
Yes, that goes without question.
That's the baseline.
I feel, yeah.
You can add to that, but that's the baseline for me.
Yeah. I would expand on that just a little bit because, as you said, Richard, there are a lot of supplements out there, and a lot of nutrients. They're all good. I mean, you look at each one, it has a positive effect. Right. And so you say, how many do I take? How do I take it? Well, as was just mentioned now, certainly you take vitamin C, well, because we should be making it and you don't. All right. So we're all pre-scurvy individuals until we start taking enough vitamin C. However, I would add at least two more to that because they're always deficient, and that's magnesium and that's vitamin D3.
Yeah.
So those three are super important because I don't think there's a person on the planet that has a normal level of any of those three without some supplementation.
Agree.
Yes. I had a patient who came to me because he was having pain in his legs and could no longer play tennis. I put him on vitamin A, and a month later he was playing.
Wow.
Yeah. Yeah, Tom and Ken, I totally agree. I do think, like I said, C, D, magnesium, and I have like a zinc. I even include zinc on it for like a very primary C, D, magnesium, for sure, those three. Everybody should take them. And not only should they take them, they should also take a higher dose, D, of course, we need to, 5,000-ish around that level, but others, the more the better kind of thing.